The lips appear to be bluish, what they call cyanotic. So you want to make sure that they're not that color, then she has a lack of oxygen. In that situation, she could have a lung problem, she could have some kind of heart problem. We'll get more into that when we get into heart and lung, but you want to certainly look at the color of the lips. You also want to look at the lips, the corners of the lips, this area right in here, the angles of the lips, and see if she has any cracking at the corners of the lips. What they would call angular cherosis. Sometimes you get that from a vitamin B deficiency, a riboflavin, it's cracking at the corners of the mouth. Or it could be especially somebody like an elderly patient who has dentures that may not be fitting properly, blessing may not be fitting properly. They sometimes get a buildup of saliva on the corners of the mouth, and that may start to crack those areas. So it could be that as a result of the dentures and it's not fitting properly. You also want to look at the lips to see does she have any lesions on her lips. For example, you could have a canker, what they call a canker of syphilis. Syphilis, when they have a lesion there, or they could have a herpes simplex lesion on their lips. They could have a cold sore, fever blister on the lips. So you want to look to see that there's no lesions of that kind. You also want to see is there any kind of crusty, hard, crusty lesion on the lip, usually the lower lip. It may be most common form of oral cancer is this, it usually hits the lower lip, so it could be something like that. You want to look at the lips, any lesions, look at the colors of the lips, things of that nature. So that's really external. Then when you start to get internal to the mouth, what you're going to do is you've got to take this tongue blade, so it says peel down here. I'm going to peel this down, and I'm going to touch this end. This end I'm not going to touch because that's where it's sterile, right? So make sure I don't touch that end, that's what's going to go in our mouth. I don't want to lay this down because then it's obviously not sterile anymore. So what I'm going to do here is I would tell the patient, I'm going to have you tilt your head back a little bit, and I'll have you open your mouth as wide as you can. And I'm going to actually take this tongue blade and I'm just going to swipe it on your tongue a little bit, just to make it a little bit more slippery, so when I move around the mouth, it won't stick to your gums and inspect and examine some of the structure of the mouth. You know what's coming, what's happening. So I can turn my light source on full intensity. So you open your mouth, and tilt back to the open mouth to the right. Stick your tongue out a little bit. Just a little bit of saliva on it. Okay? Just keep your mouth wide open. What I'm going to do is I'm going to take the tongue blade, I'm just going to move it, I'm going to kind of grab the lower lip gum area, and I'm going to look where the gum and the teeth are, and I'm kind of running along this lower lip. You can tilt back just a little bit more. And you can see as I go here, see how I'm spinning my hand? Be careful about that. As I'm spinning my hand here, and I'm looking at the teeth, and I'm looking at the gums, right? And the reason why I wet it down is as I go here, so I don't stick. I'm just moving here. Instead of me going like this, trying to do one of these jobs, I'm just turning my hand as I'm going around, right? I'm looking. So what did I really look at right now? I looked at the teeth to make sure all our teeth are there. Nothing's broken or anything of that nature. I looked also at the gum line as the tooth inserts. Was there any inflammation, like gingivitis around the gums? In that area, was any bleeding of the gums? And so I'm kind of looking at some of these things related to the teeth and gums to make sure that they're okay. Also, and again, just walk through this. I don't know how to take it like that. Now I'm going to take this tongue blade. I'm just going to pull out and take a look at the buccal mucosa on the side here, which is the cheek. And I'm going to do the same thing on this side. And if you look up towards the second molar, you'll see like a little hole in that area of the buccal mucosa. And that's the parotid duct, or Stenson's duct, that you're seeing. And on each side, at the upper portion, second molar, you'd see that. And I wanted to look, when I looked at the buccal mucosa, it should be that more that pinkish kind of color. I'm looking to see if there's any kind of lesions on there. Is there any redness, any bleeding, anything of that nature that may be in those areas. And sometimes you may see these little white lines. Sometimes people chew on their inside of their gum. It's like crushed down on it, and you get these little scars. So then I'm looking in that area, so we did all that. I would have you now just stick out your tongue. Okay, you can move your tongue up. Okay. And bring your tongue out again. Move it to the right, and to the left. Okay, right. Now again, I checked a bunch of things. When I'm looking at her tongue pattern, and we'll get into all the different patterns in the lecture, geographic tongue, hairy tongue, scrotal tongue, and there's a whole host of different tongues. Okay, some are not clinically significant, some may mean something, so we'll talk about that in the lecture. But I would look at her appearance of her tongue. I also had her move her tongue out, and I had her move it to the right, to the left, to see that she has function of this tongue as well. And I also was looking, is there any lesions anywhere on the tongue? I had her lift her tongue up to see if there's any lesion underneath, and then there's a little frenulum, which kind of connects the tongue to the bottom of the mouth. And on each side are ducts, Wharton's ducts they're called, and I was looking at those ducts also. There's also a frenulum on the lower lip and a frenulum on the upper lip that I looked at when I went through her lip area. I also, as she stuck her tongue out, I was really, in a sense, assessing the cranial nerve 12, which is hypoglossal. Right? And so if she sticks her tongue out, it should come out straight. If the tongue deviates, she could have a lesion, and the lesion would be, of course, again, the cranial nerve 12, which is hypoglossal, and it would deviate towards the same side of the lesion. You have a lesion of cranial nerve 12, it goes towards that same side. So I kind of did all that without saying it, but I was doing all that, looking. Then again, you take it back. You're not wide, stick your tongue out. I'm just going to let it flat on your tongue. Just say, again, say, Okay. All right, so what I did there was now I looked, well, one, I looked at the hard palate up on the top, the roof of the mouth. And I also looked at the soft palate, which is further back, in the back of the throat. And you'll see this, when she says, there's a little structure called the uvula that raises up. And again, I want to see that that raises up. If the uvula deviates, if there's a lesion, again, that's cranial nerve 10, vagus, it would deviate towards the opposite side of the lesion. Now, you just can't go by the uvula, because some people's uvula naturally deviates. So you got to look also, there's other structures called the anterior and posterior pillars. And between those pillars, there's her tonsils, which are a little bit inflamed, her tonsils. And there's tonsils between there. So when you look at the uvula going up, you also want to look, is that pillar, if it was a lesion, it would go towards, again, that opposite side. You want to see that those pillars also move with that uvula, or is it just a deviated uvula, with that. And then again, I was looking towards her back of the throat to make sure that, as far as the back as I can look this way, to make sure if there's any redness or any kind of lesions of any kind like that. So I look at all those different things. And then you can do the final thing, which I'm not going to do because you probably just had lunch. You can do the gag reflex. Right? So to do the gag reflex, she would open her mouth, tilt her head back, stick your tongue out. And I would take this part of this instrument here, the tongue blade, and I would just, I'm not going to do this, I don't want to gag, but I would reach back towards the back of the tongue or towards the pillar, and just kind of like touch down a little bit there. She'll probably gag if I did that. And again, that's checking the glossopharyngeal, right? That checks motor, which is vagus, and sensory portion, which is 9. And so it's going to check those different cranial nerves. And the big thing with this, when I was doing this exam, to note, what I'm doing is she has her head tilt back, just looking mouth, and I'm searching here. See how my instrument or this tongue, light source is out here? A lot of times what we see is this thing's going in their mouth. And this is in the mouth, and everything's in the mouth. And so this is not sterile, so don't put this in her mouth. This stays back here. This is what goes in the mouth. You notice how I never touch this other end, and I never put it down. When I'm talking, chatting, I'm not, checking my, it's gonna be on a map.